Starting tomorrow, you'll be able to request a free rapid COVID test through a government website. Now, the test will be available at covidtest.gov. The program will limit the number of tests sent to each residential address to 4 tests. Shipping will take anywhere between 7 to 12 days after ordering. Joining Morning Rush is Dr. Perry Halkitis, Dean of Rutgers School of Public Health. Thank you so much for joining us today, Dr. Halkitis. So this website has really been touted as some sort of a solution to the testing problem, but let's take it back and think historically, the government's launching of healthcare-related websites, so we're talking the Obamacare site in 2013, for example, do not stand up to the demand. So how concerned are you about a site crash tomorrow because of the immense demand?
Good morning. I think, first of all, I think we have to all acknowledge the fact that these tests are probably a very helpful thing to make available to the American public too, so that people can know, quite frankly, in the comfort of their own homes, whether they're infected or not. But do I believe that infrastructure breaks? Do I believe whether electronic infrastructure breaks or a bridge or a tunnel breaks if it's that there's too much of a demand? Yeah, it happens. It's possible that we will see this. Hopefully, there have been lessons learned from the past. I can tell you that here in New Jersey, when we were able to get free PCR tests during the winter holidays, the system worked pretty efficiently, and the system did not crash, and individuals were able to access their tests and have them delivered to their home pretty much without any problem. So let's hope there are lessons learned that will be applied to the development of this particular website.
Right. So tests, as we know, have been really hard to find. I'm sure you've seen all the video of those long lines, people waiting for hours and searching all these different stores to get their hands on one. But the federal government has secured more than 420 million tests for distribution through covidtest.gov, with plans to increase the order to 1 billion tests in the coming weeks. So where are these tests coming from?
Well, the federal government has contracted with the developers of these antigen tests. Let's be clear, these are rapid tests that individuals will be using in their homes. They've contracted with them. The problem I think we've had is that the supply chain has made it difficult for some tests to get to some neighborhoods. And quite frankly, if you were to do an analysis of where tests are available, there are neighborhoods in New York City that are like a mile apart, where one neighborhood has no tests and other neighborhoods and many tests. And this is, very much to me an indication of, tests being able to get to particular sites, particular neighborhoods, and that one size doesn't fit all. This approach by the federal government, being able to access many tests, makes it a much more egalitarian approach and provides tests that pretty much any American needs, as compared to limiting the person to the place where they actually live.
So when we're talking about at-home tests, there has been a lot of concern with under-reporting. And so the numbers that we report every day, the numbers we see every day might not be accurate because there could be so many more positive results. So what sort of impact could this new program have on case numbers?
Yeah, so first and foremost, you are right. We have no idea of the number of cases in the United States over the course of the last month, because so many of us have tested at home and so many people have tested positive, and that's not part of the records here. Case numbers are interesting. Case numbers are important. Case numbers give us an indication of spread. I think the bigger indicator, quite frankly, for us as we're looking at the current situation is the number of deaths. And what we've seen over the course of the last month and a half is, despite the huge surge in cases in the United States, the number of deaths has not escalated. And so what this says to me is that we have a virus in our mix, a version of the virus in our mix, which is highly spreadable, but not necessarily causing enormous amounts of death, certainly in those people who are vaccinated and those people who are vaccinated and boosted.
And I was also worried when I took some at-home COVID tests if I was even doing it properly to know that if I actually was positive or not. But I want to talk to you about messaging right now, because there's been a lot of confusion lately, especially with these updated recommendations when it comes to isolation periods. It was at 10 days and then it was slashed in half to 5 days. What exactly can the CDC do to maybe help their messaging and make it a little more clear?
I think we are all very concerned about the messaging. And quite frankly, we're all confused. I think the messaging is very simple. And then let's just say this. If you're not feeling well and if you test positive, stay in your home if it's possible, remembering that many Americans don't have this option, right? Stay home if it's possible for 3 to 5 days. And then if at that point, if you have tests from the federal government that are in your home, test at the end of the 5-day period to see if you're contagious. If you're not contagious anymore, then leave your home. So stay home if sick, take a test, take a follow-up test if it's possible, which will now be available with a test from the government, and then make a decision. I want to say one more thing actually to the viewers, because I think it's important. What I've been telling people with these rapid tests is the following. Many of them require swabbing of the inner part of your nose. I recommend to people that they swab their throats first, because Omicron lodges itself in people's throats. So swab your throat first a few times, then your nasal passages, and then undertake the test.
With the same swab, or
with the same swab?
Oh.
Yes, with the same swab.
Okay.
That's how I've been taking my tests at home. I've been putting it in my throat first, just to be able to catch or anything there. And there's some evidence to suggest that because Omicron is so much caught in the upper part of our bodies, in our throats and stuff, that is a very good source of virus if we want to actually test for it.
And really quickly, how do you think President Biden and CDC Director Rochelle Walensky are doing as far as messaging?
I think that public health messaging is extremely, extremely complicated, and this disease continues to change every single day. I think we're playing catch up constantly here, right? And I just want to remind, the viewers also that, 40 years ago when we had something called HIV, we were doing a similar catch up, right? So things are a little bit better than they were 40 years ago. They're still not great. I asked the CDC, please just simplify your messages, because complex interwoven messages are very hard for people to digest.
All right, Dr. Perry Halkitis, Dean of Rutgers School of Public Health, thank you for your time today. Have a good one.
Have a good morning.